All right, everybody. Hello, friends and family. It's a stunning day. It's a Sunday, and it's bright. And this post will be longer than normal because there's a whole lot of information to pass on, and I'll probably, I don't know when I'll post next, but here we go. So what I learned this week, this was 2 appointments at Sloan with multiple doctors and topping off with a new oncologist, is that they did get the lung cancer out of my body. I think I mentioned that, and that was pathologically it wasn't lung cancer, it was rectal cancer that metastasized, and there is active cancer in my pelvis. So in stepping back and meeting the new oncologist, who seems very methodical and precise, I am going to have my reversal surgery this Wednesday. Long awaited. Can't wait to get the ostomy bag off. Can't wait for that, because that was supposed to be 3 months. We're at the end of 6 months because of snow plowing and weather. And fortunately, it's not something I need for the rest of my life. And so you can imagine knowing that you want that gone. Certainly trepidatious about my new anatomy and how it's going to perform. But again, I knew that going in, and wanting to have the best chance of success in beating cancer, I went ahead with that surgery. So this is like the closing chapter to this first wave of cancer treatment, and I can't tell you how excited I am to have that over. So this is going to take place, and the new oncologist has recommended most likely another heavy-duty chemo treatment once I recoup from this surgery, which is 8 to 12 weeks after the surgery. So I have a hiatus here, a holding pattern in a matter of speaking, where I can do an alternative cancer treatment. So what I'm saying is, I'm going to get the surgery, and in my recovery time, where there is nothing for traditional allopathic medicine to administer or do, I am now going to take some alternative risks and see if there's any chance that I can help myself beat cancer through food. And without getting into it, it's basically a raw diet. So post-surgery, I'm going to go on a full raw diet and see if there's any truth to these alternative methods, and see when I get rescanned in 8 to 12 weeks if the current cancer in my body reduces by any margin at all. And that's why this is a perfect time, because I'm not risking any life, or I'm not risking anything, because there's nothing to do right now. But I do have this window where I was just scanned, and it is known what is active in my body right now, and its size and where it is. And so I can spend the next 8 to 12 weeks doing something else, and see when I'm scanned again prior to being prescribed another chemotherapy, if I can actually have the cancer shrink and reduce in size. Anything to give me a sign that I could possibly heal cancer through food. So that's the plan, and it feels overwhelming because it's something I've never done, but I need to do it, because the only other step is going back into chemotherapy treatment and returning to hospitals every 2 weeks and wearing a chemo pump for 48 hours after. And I certainly would have a better head going into that if I clearly saw that there was nothing else. So this is my opportunity, and it's what I'm going to plan to do. So the next time I post, it will be after the surgery. I'm supposed to stay in the hospital for 3 to 4 days post-surgery. Just send your love and prayers, and I'll touch base, in a couple weeks.